Hello, my name is Irina Kakurin on my channel EduLand. Today I want to dedicate this video to the new NCLEX exam that will be introduced on spring 2023. There are some important changes on the exam that we want to share with you. I couldn't think of the better expert of the Institute of Career Continuity, Professor Allison Chisholm, to give us all overview. She has a master's degree in nursing. She is a registered nurse educator who was invited to work on designing test questions by National Council of State Board of Nursing. Hi, Allison. How are you doing?
Good. How are you?
Good. I'm very happy you're here to answer for some of our questions. Okay?
Okay.
Could you please introduce yourself?
My name is Allison Chisholm. I'm a registered nurse for 30 plus years. I have a bachelor's in nursing and a master's in nursing education. I currently teach nursing at Swedish Institute College of Health Sciences, and I teach phlebotomy with ICC online. At least twice a month I do a class.
Good. So we are here because they're going to change some NCLEX exams, and I'd like to ask some questions regarding these changes.
Okay.
Okay, let's start.
All right.
When will a new version of exam be launched?
So next gen will be launched April of 2023, and it's called NGN, Next Generation NCLEX.
Why has a new version of exam been designed?
The reason why they're designing a new version is because they have done statistics, and 65% of new graduates make the most medication errors because they don't see the nurses using critical judgment.
Unfortunately.
Yeah, the biggest errors, and then the pass rate has decreased for first-time users. 13% of first-time users usually fail the state board, and it's because they can't critically think. Critical judgment, critical thinking has become it's always been an issue with nurses. You can't actually teach critical thinking, so you have to test it to provide lecture material for students for them to absorb it, and then take that information and be able to apply it to the examinations using critical thinking.
Okay. What type of questions have been added?
So they'll have the standard multiple choice. They're doing questions relevant to like bow tie questions. So the student will get a scenario, or they'll get some information about the patient, and then what they call a bow tie. They have to tie all of the information together to tell NCLEX what possibly could be wrong with the patient. What do you anticipate the doctor ordering? And you as a nurse, what are your nursing responsibilities going to be? They've added, I know it's bow ties. Oh my God, I have a spasm in my brain.
No problem.
What I can tell you, the questions that are going to be added, and I sent you some information. I sent you a video, and then I sent you, and I don't know if I can bring it up. You can still see me, right?
Right.
I'm going to go to the email that I sent Elena. Basically, they want the nurses to be more efficient in terms of taking care of patients and being able to use great critical judgment. So it's called a clinical judgment measure model. And there's a graph that I sent you that designs how questions were thought about. So some of the questions will be to recognize clues. Certain information will be given about the patient, and the nurse needs to recognize clues as to what clues are going to tell her what's wrong with the patient. Then they want her to take those clues and analyze them. and then prioritize hypothesis. What's the first thing that should be done versus the last thing? Then they want the nurse to generate solutions. What are you going to do for the patient? What do you expect the doctor to actually order for this patient? Then they have they're still going to have select all that apply questions, but instead of, so you have 6 choices. If you get 3 out of 4, you'll get partial credit for your actual answers. So it's not like it's one and done and you know you don't get the full credit of the questions. They're going to have extended drag and drop where you could be looking at a chest and they may ask you where certain aspects of the heart, certain anatomy of the heart. You may have a drop and drag of an EKG strip and they want you to tell you what's on the strip.
It's absolutely
So
new question.
those are yes, those would be the new questions.
Mhm.
Yeah. So more case scenarios so that students can read the case scenario and determine what's going to happen. What do I need to do?
For now, exam starts from 75 questions up to I don't remember.
Well, see, with COVID, they haven't gone back to pre-COVID. So right now they're still doing 140 questions.
Okay. Questions new exam will have.
It'll have the same amount. The test is a 265 questions. So until they go back to that, they'll still be with the COVID restrictions and still have 140 questions. So now when nurses go and take the state board, I think 30 of their questions are practice questions of next gen. Because one of my students that just graduated, she took her state board, she passed, and she had about 25 questions. They were survey questions, and they were all about next gen. And she said they were really hard. She said she's glad she didn't have them on her test.
Yeah.
So it'll be the same. I don't think the amount of questions, it's not going to change. It's just the type of questions will change.
Okay. The same light of the exam?
Say that again?
The same light of the exam? What is the light?
Yes.
Okay.
The length of the exam?
Yes.
Well, now that it's 140 questions, I think they get 4 hours. If it was the 265, I think they get 6 hours.
What about scoring of the exam?
The scoring will change because of the select all that apply. You'll still get partial credit. So students can probably score better on these exams because they're awarded more allowances with partial credit to questions, which is a benefit.
Okay. Yep.
Just one benefit.
Okay.
Exactly.
How many case scenarios will be in the exam?
That information is not published. They'll never publish that information. They'll never. I can't even say how many. You know, it depends on the exam, but that's not going to be published information. That would give away the test plan.
Okay. Do you know there our students can find the preparation material for this exam?
So they can go onto the NCSBN website and they have the RN test plan.
Okay.
They have RN PN. Every test that NCSBN publishes or gives, there's a test plan on their website.
Okay, I will put the link on this website under my video. Okay, thank you.
So, did you get the email I sent you?
Yes.
With all of the answers to your questions? I sent you a newsletter and then I sent you a very good video that you should watch that talks more about NCLEX and how it's scored and all of that information. You can tie that into your interview and you can use that probably as a link because I sent you the link as well.
Thank you very much, Allison.
You're welcome.
I hope this information will be helpful for our student, for our graduate, and it's help them to pass exam.
Well, you know, I was fortunate enough for 2 years in a row to go and write questions for them. I went in July to write questions, and I've been a nurse so long, I could see how these students are going to get tripped up with these questions. Teaching nursing, seeing the caliber of students, you know, these students today want everything quick, quick, quick. And nursing, you can't do quick. So I could see a change in the types of nurses that will be passing or failing this exam, because it's not going to be easy. It's not going to be easy at all. It really isn't. The test is going to be designed to have students who have taken the time to learn the information, process it, and apply it. Those are the ones that are going to be successful with this test.
Okay. Allison, thank you very much for your interview. Thank you.
You're welcome.
Have
a good weekend.
You too. You too. Bye.
Bye-bye.